So does anybody know why, when we're speaking about maternal mortality rates internationally, why we're almost exclusively speaking about the developing world? 99% of pregnancy-related deaths occur in the developing world.
Global reproductive health. When I think of global reproductive health, I think of work.
Also think about health in terms of their voices and being heard about their concerns.
I think of all of the sisters in developing countries that have yet to get full agency and the privileges that we reap in the United States.
There's a reason why the U.S. and the West has almost completely eliminated these kinds of deaths. I mean, the maternal mortality rates in the U.S. is 1 in 4,800, which is one of the highest for industrialized nations. It's 1 in 29,000 in Sweden, but it's 1 in 6 in Afghanistan. So you can see these disparities and what the numbers tell you.
The root cause for health disparities are not being addressed. So what are the social factors that go into why there are more women of color who are being impacted by maternal mortality or infant mortality? Those things are not being addressed.
When we think about global reproductive health, there are many things that are at stake.
HIV and AIDS is clearly an issue of reproductive health and sexual and reproductive health and rights.
Then, if you look at it in terms of HIV, there's this whole issue of ABC, which is abstinence, be faithful, and condoms. So then if people are always using condoms as they're being advised to do, then what happens to particular populations? How can we procreate if we're using condoms? So then, and at the same time, if we don't use the condoms, how can populations survive? So these issues are really critical to global women's health, global reproductive health.
Female genital mutilation is one of the most insidious practices that has been maintained for so long and that has yet to really be intervened based on cultural relevancy, as if that's not flat out wrong, and criminalizing and dehumanizing. I think that FGM is something that needs to be stopped immediately, but continues because, again, our sisters don't have the agency that they deserve.
I don't know if you know about the global gag rule, defunding the United Nations Population Fund. I mean, it was really front and center, anything and everything to do with abortion. Basically, any overseas organization, so these are international organizations, they're not even in the U.S., that receive any U.S. funding cannot advocate or even recommend abortions. It's a step in the right direction. It's called the Lautenberg Amendment, and what we're trying to do is to stop the global gag rule, to eliminate it permanently, and to stop it from being an executive order.
There is the issue of contraceptives being given to women in developing countries that are not necessarily safe for them. They've been used as guinea pigs over and over again, and then once some of those contraceptives are made available on the market, they're not available in those particular countries. So there is that way in which women's bodies are being exploited.
Women of color in the U.S. on these very critical global issues tend to start doing exactly what the rest of our country does, which is, have this real myopic, single vision focus on these critical issues overseas, as if we don't have these same issues at home.
Currently, there are 200 million women who want to delay or prevent pregnancy but don't have any access to contraception.
Women in the South suffer so much more. The southern U.S. is the domestic microcosmic experience of the southern region of the world. And so if we looked at the women of color stories alongside women of color in the rest of the world, then it wouldn't be that different.
One of the other problems is that sometimes we have a tendency to portray women from other countries as victims, always as victims, but yet women are doing things on the ground every day. And often these things are not talked about sometimes that work is almost invisible.
I used to dream, I used to glance beyond the stars.
Women of color, and particularly black women, have always sought to control their bodies and always sought to control their fertility.
Really, at the crux of it all is women's sexuality, our ability to make our own choices, to protect ourselves, to plan our pregnancies, to determine our own outcomes, and to be sexual human beings.
Where are we now and what are we doing?
We want to shift the culture so that reproductive justice just becomes a way that you understand. It's a broad understanding. It's not very limited.
So what our campus groups basically do, our Feminist Majority Leadership Alliances all across the country, what we do is educate on our issues. And what we're trying to do with them is let them shape and direct U.S. foreign policy on women's lives. So that's a really, really big part. The work that we're trying to do now is substantially increase U.S. assistance to international family planning, because whatever the U.S. does, and it's really true for the rest of the world, will follow.
It's really critical for women in Western countries, for us in the U.S. to understand how some of our everyday habits impact women in other countries, how it impacts their health. And if we don't make those connections, then there's no way that we can ever change this.
In our